Today, we are diving into a really important report about what's happening in Hawaii's healthcare system because, well, it's heading towards a major crisis. We're talking about a serious and growing shortage of doctors that's making it tough for people to get basic medical care. You know, that first stop, your family doctor. So let's get right into what's going on.
That's a pretty heavy statement to kick things off with. The report is basically sounding the alarm, saying Hawaii is on a path to becoming the least medically served state in the entire country. And we're not talking about some far-off future. We're talking within a decade. It's a real tipping point. So what's actually driving this?
Okay, first up, let's get into the actual numbers. Just how bad is this shortage?
As of right now, the state is short more than 150 full-time primary care providers. And that's not some future projection. That's the reality on the ground today. You have to remember, every single one of those missing doctors represents thousands of patients who might be struggling to get an appointment.
And here's what's really got people worried: the speed of all this. The gap has grown by almost 30% in just 5 years. This isn't just a slow drip. The problem is getting worse, and it's getting worse fast.
And just look at the scale of this. This isn't just a small, isolated issue in a couple of remote areas. Literally half of all counties in Hawaii are now federally designated as health professional shortage areas. This is a massive, statewide problem. Now, even though it's a statewide problem, it doesn't hit everyone equally. The burden is heaviest on the neighbor islands. The situation is so severe that the report points out that people might actually have to get on a plane just to see a doctor. Can you imagine the cost, the time, the logistics of that?
So, okay, we've established there's a doctor shortage. Big deal, right? Well, yeah, it is a very big deal, and the ripple effects are massive. The report shows how this touches everything from the finances of local clinics to the health of entire communities. Let's dig into those hidden costs.
This chart tells a really clear story. It's like an economic vice is squeezing these independent clinics. Over the last 10 years, their overhead costs, rent, staff, supplies, have just skyrocketed, up 60%. And during that same time, the payments they get from insurers have gone nowhere, totally flat.
And you know what happens when your costs go way up, but your income stays the same? Well, you start losing money, a lot of it. We're seeing independent clinics report that they're losing up to 40% just to keep the doors open. No business can survive that for long. And that's exactly why rural clinics are closing down faster than ever before.
You might be asking, well, why don't they just hire more doctors? It's just not that simple. It's really hard to attract doctors in the first place when, after you adjust for the super high cost of living in Hawaii, they end up earning 30% less than their peers on the mainland. That makes recruiting new talent and keeping local doctors an uphill battle.
But this isn't all just about spreadsheets and financial reports. There's a very real human toll here. Doctors and nurses are burning out. The lack of access is hitting Native Hawaiian, Pacific Islander, and women's communities the hardest. And when people can't get basic care, they put it off. And they often end up in the ER for things that could have been prevented, which just chips away at people's trust in the whole system.
But the report doesn't just point out problems. It also makes a really powerful economic case for fixing this. It starts with this. Think about investing just $1 single in primary care,
Because for that $1, you get this: $13 in savings down the line.
And here's the magic behind those numbers. That $1 you invest in preventative primary care, it saves up to $13 in much more expensive care, like ER visits and specialist appointments. So supporting primary care isn't just a cost. It's actually one of the smartest, most effective ways to save money in the entire healthcare system.
So that brings us to the big idea for a solution here. The report lays out this community-driven plan called the Primary Care Protection Act, and it's designed to tackle these problems head-on.
So what is it exactly? Well, at its heart, the Primary Care Protection Act, or PCPA for short, is all about making sure that primary care in Hawaii is protected, that it has the funding it needs, and that it's actually sustainable for years to come.
So how would it actually work? Well, it's basically built on three main ideas. First, it secures funding by making sure a fair slice of the healthcare spending pie, 12%, goes directly to primary care. Second, it makes sure doctors get paid on time, freeing them from those long delays that can kill a small clinic's cash flow. And third, it supports all kinds of clinics, including urgent care, to make sure people can get seen no matter what.
All right, as we start to wrap this up, let's circle back to the main point, that big idea from the report.
just how important primary care is for absolutely everyone. This is really the key takeaway right here. The report calls primary care the backbone of the entire health system. It supports everything else. And all the data we've just looked at, it's showing that backbone has some serious cracks in it, and it's at real risk of breaking.
And that really leaves us with this big question. Not just for folks in Hawaii, but for any of us, really. When the very foundation of your health system is shaking, how do you protect that backbone? What do you do to reinforce it before it's too late?